So, you're getting started in phlebotomy? It's a fantastic career, but it is all about precision. I mean, even the tiniest slip up can have some pretty huge consequences. So, we're going to dive into the top 10 mistakes new phlebotomists make, and most importantly, how you can steer clear of them.
Take a look at this number, $200,000. What do you think that is? Well, according to research, that's about how much specimen collection errors cost an average 400-bed hospital every single year. That's money spent on redraws, messed up treatments, you name it. But honestly, the real cost is way, way higher.
Because the real cost isn't about money, it's about people, it's about patient safety. These mistakes can delay a diagnosis, lead to the wrong treatment, and yeah, they can put a stop to your promising career before it even gets off the ground. Getting this right from day one is absolutely crucial. All right, let's kick off our countdown with the common procedural pitfalls. These are the mistakes that happen right there in the moment at the patient's side while you're actually doing the draw. Kicking off our list at number 10 is a mistake that is so easy to make: lack of communication. It's so easy to get laser focused on the technical stuff, finding the vein, getting the needle ready, that you forget there's a person attached to that arm, and odds are they might be really nervous.
And you know what? The fix is incredibly simple. Just talking. Introduce yourself. Explain what you're about to do. It can make a world of difference for a patient's anxiety. If you don't, that fear can just spiral, which makes the draw harder for you and a truly awful experience for them.
Sliding into the number 9 spot is a big one: poor technique and vein selection. This is really where your hands-on skills get put to the test, and getting this wrong can cause anything from a simple bruise to some pretty serious patient injury. So how do you nail this? Well, first, it starts with picking the right vein. Your go-to, your absolute best bet, is the median cubital vein. Next, check your angle. You want to be between 15 and 30 degrees, with the bevel, the pointy tip opening, facing up. And finally, you have got to immobilize that vein. Use your thumb to pull the skin taut right below where you're going to stick. It keeps the vein from rolling away. Coming in at number 8 is an error so common it's practically a cliché, but the consequences are no joke. We're talking about incorrect tourniquet use. It seems so basic, but getting the timing wrong can quietly destroy your sample before it even gets to the lab. Listen, the rule here is simple, and it is absolute. A tourniquet stays on for 1 minute max. Any longer, and you risk something called hemoconcentration. That's where the blood gets artificially concentrated, and it will throw off the test results completely. The best practice? Pop that tourniquet as soon as you see blood flowing into the tube. Okay, our 7th mistake is a monster. It's so important that you're actually going to see it pop up again later on this list. It's causing hemolysis, which in a nutshell is when you accidentally destroy the very sample you're working so hard to collect. So what exactly is hemolysis? Well, think of red blood cells as tiny balloons. Hemolysis is what happens when they burst. All their insides, like potassium and hemoglobin, spill out into the sample. This contamination just wrecks the test results, and it almost always means a painful, unnecessary redraw for the patient.
And believe me, this isn't some rare freak accident. As experts from sources like the To The Point articles in Phlebotomy point out, there are tons of causes. It could be your needle technique, or it could be as simple as shaking the tubes too hard afterwards. So let's look at how to stop it. First, your gear. Use a 23-gauge needle or larger if you can. Tiny needles can literally shred the cells. Second, when you're doing the draw, make sure that needle is seated properly to get a good solid flow. Slow, traumatic draws are a big cause. After, handle those tubes like they're precious cargo. Gently invert them, never ever shake them. And finally, fill those tubes up to the line to get the blood to anticoagulant ratio just right. And rounding out the first half of our list at number 6 is messing up the order of draw. The sequence you fill your tubes in isn't a suggestion, folks. It's a strict, science-based protocol designed to prevent cross-contamination. Here it is, the official order of draw. Blood cultures always go first, to keep them sterile. That's a no-brainer. But what about the rest? Well, think about it. If the additive from the lavender top tube accidentally got into the red serum tube, it could make the calcium levels in the sample look falsely low. Following this exact order every single time prevents that kind of mix-up. All right, we've made it through the first half. Now we're getting into the top 5. These are the heavy hitters, the errors that can lead to the absolute worst consequences for your patient and for your career. At number 5, we have underfilling tubes, or what's known as a short draw.
This is a huge problem, especially for tubes with additives in them, like the light blue or lavender tops. See, if the tube isn't filled to the right level, the delicate ratio of blood to the anticoagulant gets thrown completely out of whack, which can make the test result totally invalid.
Mistake number 4 is a real test of your professionalism. It's not following the 2-attempt rule. The standard is crystal clear. After 2 tries, if you haven't gotten the draw, you stop. This isn't about giving up. It's about patient safety. Your next move is to find a more experienced colleague to take over.
It is so easy to feel that pressure to just get it done. But turning a patient's arm into a pincushion is just wrong. It causes pain and increases the risk of injury. So remember this. Knowing when to stop and ask for help is a sign of professional strength. It's a commitment to your patient, not a failure on your part.
Our third most critical mistake is just catastrophic, but it is 100% preventable. It's failing to properly label your samples. An unlabeled or mislabeled tube is useless in the best-case scenario and downright dangerous in the worst.
The rule for labeling is completely non-negotiable. You have to label every single tube right after the draw, right there, at the patient's side before you even think about leaving. Never ever pre-label tubes, and don't walk them over to a counter to label them later. The label needs, at a minimum, the patient's full name, their date of birth, and the exact date and time of the draw. No shortcuts.
I told you we'd be back to hemolysis. Here it is at number 2. And this time, we need to talk squarely about the consequences. A hemolyzed sample can make a patient's potassium levels look sky high. A doctor could see that result and prescribe a medication that could actually be fatal, all to fix a problem that doesn't even exist. It can also mess up liver enzyme results and hide other critical information. And that brings us to the number 1 most serious mistake a phlebotomist can possibly make. But before I spell it out, just look at this slide. On the left, you've got the common, dangerous shortcuts. On the right, you've got the required protocol. Just asking, "Are you John Smith?" is not good enough. You must have the patient state their full name and their date of birth to you, and then you actively check that against your form and their wristband. The number 1 mistake a phlebotomist can make is improper patient identification. It is the most preventable error, and it is also the most serious. Because if you get this first step wrong, every single thing that follows, the draw, the label, the test, the diagnosis, the treatment, all of it is being done for the wrong person. So after all that, how do we get past these mistakes? How do you build the skills to become a true professional? Well, it really all boils down to one key idea. Just like the sources for this explainer show, almost every single error we've talked about comes from one of 2 places: a gap in your training or a failure to build consistent, correct habits. So good training and disciplined, mindful practice aren't just suggestions. They are the bedrock of a safe and successful career. And that brings us to the end. The most important thing to take away from all this is that excellence doesn't happen by accident. It's built, one correct habit at a time. So I'll leave you with this to think about. What is the one habit, whether it was on this list or not, that you will commit to perfecting starting today?
Thank you for watching. Like, share, and subscribe.